Welcome back to CTV Morning Live. We are coming off of October, which was Breast Awareness the month. And this month, starting November 1st, we are heading into Diabetes Awareness Month. And joining us to talk about the programs and to talk about what we're dealing with right now with diabetes is from their public programs, Rini Leibovitz. And also we have Jennifer Stepetich. Did I say that almost right? Stepetich.
Perfect.
Who's joining us. She's a diabetes nurse educator. Great to have you ladies on the show. I'm going to start with you, Rini, because it's an interesting milestone right now, the 90th anniversary, is that right, of the discovery of insulin?
That's right.
That's huge.
So it was in 1921 that Sir Frederick Banting and his friends discovered insulin, and so this is the 90th anniversary, and it's a very special year.
I mean, it's become the key component in terms of fighting this, and there's a lot of people that need to fight it. The numbers in terms of who's being diagnosed is quite large.
There's 1 in 4 Canadians that are living with diabetes, pre-diabetes or undiagnosed diabetes. And if the trends continue, it's expected that it will be 1 in 3 by 2020.
That's a pretty fast change of people 1 to 4 to 1 in 3. Lots of programs planned for you over the course of this month.
We are. We're very excited about, we have a South Asian Symposium coming up on November 5th at Franklin Place. We have a celebrity challenge taking place on November 14th, World Diabetes Day. That's also Sir Frederick Banting's birthday. And we have our first ever gala, Eat to Defeat Diabetes. So people have opportunity to get involved and support the association.
And these are major fundraisers that are needed to be able to get the information, the awareness, the research being done. All right, there you come into play. This is something that you're dealing with on a daily basis with a lot of the patients that you see. What are we looking at in terms of the different phases of how people are battling diabetes?
Well, with diabetes, we look at there's two main types of diabetes that people know about, type 1 diabetes and type 2 diabetes. Type 1 can be a very rapid onset, where somebody's pancreas just stops producing insulin. So in their case, they're going to go directly onto insulin, no oral medications needed.
Is this something that could just literally come on?
It can, especially with children and younger people, but we're getting that broadening of age ranges for even diagnosis of type 1 diabetes. The other type of diabetes, type 2 diabetes, you can actually have a pre-diabetes first. And what's happening in both pre-diabetes and type 2 diabetes, first off, you're making less insulin, almost as if your pancreas is going into retirement. And secondly, your body's having trouble using the insulin. Okay, so in those cases, you can start off sometimes managing your diabetes and keeping things under control with diet and exercise, healthy eating. You may move on to needing oral medications, and you may even need insulin along the way.
Have you seen people be able to deal with this in terms of healthy eating, good exercise, that this is the best format in terms of fighting this off as long as possible?
It's a key component. It's one of the tools, and there's, a lot of times people think that if people ended up on insulin, it's because they weren't doing the diet and exercise, but the reality is, over time, diabetes is progressive, and your pancreas just needs more help.
And this is something that you probably see, a lot of the times is the transition that we're going through. Are we seeing changes? Is the research that's being done, is it making a difference, especially, when you're looking at trying to raise these funds and awareness over the course of this month?
Huge difference in how people can manage their diabetes. The insulin injections, we used to see pictures of huge syringes that you had to even boil parts of them to clean them and sharpen your own needles. Now the needles, some of them are as small as 4 millimeters. Instead of a syringe, you can use an insulin pen, tiny, easy to use, a little more discreet.
And probably a lot less frightening for a lot of these children, unfortunately, who have,
Yes.
are needing this on a daily basis. There's tons of information. The best thing to do is to check out the website diabetes.ca. Of course, there's plenty of programs that are happening over the course of the month, and take part in possibly the first ever gala that you're hosting. And November 14th is World Diabetes Day. Is that right? And then you can head to the website for more information and questions too, if you're thinking that you're following along these lines. We do have to take a short commercial break. We are going to be back. We want to get to the top news headlines at 7 o'clock. Plus, we're going to be calling out those 5 names for the seat in the heat, and that's coming your way in about 2.5 minutes' time. Stay with us.